Hi, Glenn. Thanks for joining us. Welcome,
Morning, everybody. Just going to take a few minutes to get everybody in. So thanks for being with us on a time change Monday, just to throw you off a little bit.
Good morning, everybody. We've got a lot of people joining us today, so it's going to take a minute for everybody to get in. When we get started, I just want to
Jan Schakowsky, I'm in.
Wonderful. Thank you for being with us, Congresswoman Schakowsky.
Absolutely.
Yes, thank you for joining us.
I'm happy to be with you. Thanks for doing this.
I just want to remind everyone that please put yourselves on mute, and as you probably noticed when you got on, we are recording this event. If we could have all the legislators or legislative staffers who are on the call, please put your name in the chat so that we know that you're here. Legislators and staffers, if you can put your names in the chat. Thank you all for joining us today for Aging Equity Age Guides Advocacy Collaborative. My name is Gretchen Knowlton. I'm the Advocacy Manager at Age Guide, and I'll be facilitating the meeting today. While we wait for a few more people to jump on the call, we're going to put up a poll for you. Some of you may have never thought about this, but it's never too soon to start thinking about where you would like to grow old. Melissa, can you put up the poll for us, please? You can click on this poll and you'll be able to answer the poll question.
Hey, you look like you've got 70, how many people? 72 people are in.
Quite a few people already on the call, you're right.
Where do you want to live? What is this?
We've got quite a few legislators signing on with us and staffers. Thank you all for joining us. Are we able to get the poll up there?
Gretchen, the poll is up.
Oh, good. Okay.
I received it. I just took it. So
All right. Excellent. Thank you.
good
I'm not
question.
on my
Yeah.
end. So.
Yeah,
Excellent.
good
Just tell us
question.
where you
Love it.
want to live. Excellent. We can, after it slows down, you can close down the phone, Melissa. You'll have to read off the results since I can't see them.
Do you want me to end it?
If it's slowed down, go ahead.
So we have 2% in long-term care or nursing home, 2% in retirement communities, 7% with extended family, and 90% in their own home or community.
Excellent. Thank you all for participating in that poll. And it's not a surprising result at all, is it? Those of you who said in your own home and community, you're definitely not alone. 3 out of 4 older adults in a recent AARP survey said that they want to stay in their homes and communities as they age. So how do we make this possible? We're going to be talking this morning about how to ensure that we can all stay in the community as we age. So that's what we're going to be doing here today. Again, if you're a legislator or staffer and you're just getting on the call, if you could please put your name in the chat. Thank you for being here. Welcome, everyone. We're so happy to have you here. This is our agenda for the day. And as you can see, we have an excellent lineup for you this morning. Marla, our CEO, will kick us off, and Courtney Hederman from AARP will present the keynote. Then we'll move on to hearing from community providers and a program recipient about essential services and caregiver services in particular. Next, we'll share our advocacy opportunities regarding equity and longevity. And finally, we'll be able to hear directly from the legislators who have joined us today. I'm really excited about this collaborative this morning. As you can see, we have a great turnout from our elected officials. I want to acknowledge each of our legislators and staffers who've joined us this morning. We're so glad that you're here. A special thank you to the legislators who are on the call in person. Congresswoman Schakowsky, thank you so much for being here today. State Representative Michelle Mussman, State Representative Nabila Syed, and State Representative Natalie Manley. Some of the staffers on the call will also be sharing messages from their legislators. I'd also like to welcome and thank Director Paula Basta from the Illinois Department on Aging for joining us today. If you have any questions during the presentations, please feel free to put them in the chat and we'll get to them as we're able. And now I would like to introduce Marla Franzak, our CEO at Age Guide, to welcome you. Marla.
Thank you, Gretchen. Well, good morning, everybody. Welcome to Age Guide's 2023 Advocacy Collaborative. I'd like to start things off with another poll, just a really quick one on longevity. And I always like to kind of ask this because I feel like it really frames the conversation. So how long do you hope to live? And if you can take that quick poll, that would be great. Just give you a quick minute or so just to pop that one in. Always excited to see who wants to be super agers here. So, all right. How are you doing on the poll? You want to end it? Was it a quick one or just give us a rough idea? If we were in person, I'd just take a quick show of hands.
We have 5% in their 70s, 32% in their 80s, 53% in their 90s, and 11% 100 plus.
Awesome. I love it. So I'm here to let you in on a little secret today. And it's the secret to a long, healthy life, and it's based on science. So for all of you that want to live that long, this is your secret. When an older adult or their caregiver receives community-based services, their health and longevity is improved. Social determinants like the resources in our community and where we want to live affect a wide range of health and quality of life outcomes. Gretchen, you want to go to the next slide? You want to take down the poll slide? We all like to think that we're in control of our destinies. But in fact, it's not everyone that gets to experience aging in the same way. Too often, health disparities break down along racial and ethnic lines, such that older adults of color, unfortunately, don't get equal access to healthcare and supportive services. The good news, though, is that services Age Guide provides through its funded partners actually moves the needle on important outcomes and evens out access to healthy aging. As Illinois' aging population becomes more racially and ethnically diverse, we need to better address the barriers to accessing life-giving resources. At Age Guide, we strive to build equitable longevity in our region, but it will require bold and collective action. In 1965, the Older Americans Act made it the responsibility of federal and state governments to invest in maximizing the quality of older adults' lives, regardless of economic status. This includes not just healthcare, but also meaningful participation in civic, educational, and recreational opportunities. The act authorized area agencies on aging like Age Guide to deliver efficient community services through a coordinated continuum of care and to protect older adults against abuse, neglect, and exploitation. We have to work hard every day to fulfill the bold promises of 1965, and we still need resources to catch up to them, especially the social components that are every bit as impactful as healthcare. These investments are critical to ensuring our network can support a robust workforce that delivers these home and community-based services. That collective action is vital to deal with a growing paid caregiver shortage and supporting the unpaid caregivers that older adults need to remain in their homes and communities. We need to continue to bridge the digital divide so older adults not only can afford and access technology, but also productively use it, because so much of our life depends on using that technology. Here today, we have an opportunity to listen and learn about the ways we can advocate for equitable longevity that promotes healthy pro-aging communities. Together, we can make Northeastern Illinois the best place in the state to grow old by maximizing human flourishing well into our longer years, beyond anything our grandparents could have imagined. We're so grateful for you being here today. We're especially indebted to our network of funded partners and their volunteers who go above and beyond every day to make sure older adults and caregivers get what they need to live in the community. Their resilience and their ingenuity gives our older adults the life-changing resources and meaningful services they need to thrive. Together, we are going to cover a full spectrum of our work here, from addressing social isolation to supporting unpaid caregivers to leveraging technology to deliver programs and services in new ways. We're going to learn more about healthy aging and how it happens in the home and community, because as you saw by the poll, that's where we all want to be. So to kick off our conversation, I would like to introduce Courtney Hederman. She is the Senior Associate State Director of Advocacy and Outreach for AARP, and she is one of our co-sponsors for today's event. So I'll turn it over to Courtney. Thank you.
Thank you so much, Marla. Really appreciate it. And thank you so much, Age Guide, for hosting this wonderful forum. I'm so glad that we're all together today, and just really honored to be a part of this. And of course, for AARP to be one of the partners with Age Guide for so many years, but especially for today's program. Just so much appreciate the opportunities that we've had together and our continued work together. Not only Age Guide and AARP, but all of us. We all have a piece of this puzzle and a piece of the pie that we need to work together to really make sure that older adults in our state, and particularly in this northern part, they age with dignity and grace and have all the resources they have and can have to do just that. So just wanted to kind of paint a little bit of a picture. A very good job actually in setting me up in a lot of ways. But when I actually did to kind of prepare for this, I was like, gosh, what's the current kind of status of older adults? Like what's really working and kind of what's not really working, or what are the challenges that are ahead of us? And when you kind of look at demographics in general, and this really does, I think, fit perfectly into what is already within the poll, and obviously what Marla has already spoken about. But people are living longer, and we certainly want to, right? We just said that for ourselves even. So many people are living much longer and older. We certainly have much more of a racially and ethnically diverse population in older adults, more than ever so, which is amazing. People are actually working longer as well. They're not just like, stopping at 60. Most people are actually working much longer, although there's lots of workforce issues. But again, more and more people are maybe staying part-time or doing some sort of work in what we would define as retirement years. And then this is kind of amazing, but more and more people are aging in place. And I think that's because there's a lot of infrastructure that has been set up for people to age in place in the way they want to. And so I think, though, we have, as much as all of that sounds really good, we have a lot of challenges, and our challenges are very specific, but also in these kind of broad categories. When you look very specific, you look at the obesity rate. People are, we have, I mean, I like to think the United States has the best healthcare in the world, right? I mean, and we have so many things that afford us the new technology and new opportunities in our healthcare system. But essentially, we have really bad health outcomes. And we're not the healthiest people on the planet. And so we certainly, obesity is a big part of that. We also have a significant economic disparities. So as people are aging, the spectrum of what they can actually afford or how someone is aging in place, it might not be just, oh wow, we're in the golden years and people are sitting on the couch eating their bonbons or they're trading all over the world because they have all this money in their pocketbooks to do whatever they want with it. More and more people are living a social security check to a social security check and less than. And so we have tremendous economic challenges as we look at our older adults. Also, as much as people are aging in place or kind of living in their community in some way, shape, or form, more and more are living alone. And there's lots of reasons probably for that, but I think certainly when we look at COVID and the pandemic, all of us feeling very isolated. Think about the person who's been isolated for many years, and COVID has even put more of a spotlight on it. So social isolation for older adults is a challenge, it's a problem. Sorry about that. We were actually just doing a study in AARP, and it talked about how we can just reach people in a different way. And one of the struggles we have in just reaching people is that they're not even just homebound, but they prefer to be at home now. They don't want to be out. They are feeling socially isolated, but they're choosing that too now, outside of just that might have been the circumstances during the pandemic. So we have a real challenge in reaching our older adults too, when they need us very specific and very concrete information and details to help them, again, live their best possible life. And then also very specific in a disease category. Alzheimer's disease and dementia are very significant right now. It is the probably fastest moving disease, chronic illness that's really for that over 50 plus. And AARP is very concerned, but the studies are showing too that Alzheimer's disease is something we need to pay attention to more so than ever before. So why did I say all this? Why did I say all this? So the reason why is because our older adults need many things. And here's our real buckets. Here's our big buckets of categories. We have to address healthcare. We're talking protection of Social Security, Medicare, Medicaid. We have these programs that are the backbone of people's healthcare and healthcare coverage. We must do that. So I'm actually definitely looking at Congresswoman Schakowsky. She's been a full leader in this area for many years, and I know we'll be continuing to do so. We have huge conversations we need to have at the federal level on protections of these programs and just strengthening of these programs. So again, people can have what they need and it's the most affordable. So they're getting great care, they're getting access to care, but of course, ultimately they are doing it at the most affordable price, because how can you afford stuff? It's great to have a medical card, but if you can't use it because you can't afford it or you can't see a doctor, those are huge problems. The second big bucket is actually caregivers. And this is my big pause to say there is so much happening. That's actually a term that now candidates use, elected officials use, policymakers use, older adults use, younger people use. It is actually a word that exists now in our vocabulary. 10 years ago, it was not. So caregiving has gone a very long way from when it first kind of that conceptual piece started. And caregiving is, we all know this. I know I'm preaching to the choir on this one, but it's a thankless job. There's so many unpaid family caregivers, particularly that need resources, need support. So again, that their loved one, their friend, their neighbor can live in their community or live how they choose, certainly aging in place, they need supports to do that. And as much as we can talk about how nursing home care has many challenges and needs to be looked at in a bigger way, so those that are in a nursing home get the best quality care that they should receive, we need to talk about home and community-based services and the support so someone can live at home in their community as long as they're able to. And caregivers, big part of that conversation. Caregivers allow that to happen, allow those things to take place, and we need to support our caregivers. The third piece is actually still relates to, I would define as healthcare, but it still is an important standalone, and that's prescription drug affordability. Yes, there's been lots of movement in the last several years around prescription drug affordability, but again, someone cannot remain healthy if they can't get their medication and don't use it properly or don't take it properly because they're very, very afraid of price and they can't afford it, they can't receive it. So we need to continue to talk about prescription drug affordability for all. And then finally, is just, again, that financial security piece. We're talking tax credits and pocketbook issues. And as much as, healthcare is, again, if you don't have your health, you don't have anything. The thing is you have to have money to support those things, support those healthy outcomes that we all want to have. And financial security and resiliency is really important in older adults as they age. Many people, again, are that Social Security check to a Social Security check. Not everyone has the financial resources to do everything they can. And again, we look at the care of kids, then you have a lot of money on there. We have real financial issues. Look, we're just, today, if you're looking in the news media, there is, a bank crisis. So financial security for older adults is a huge issue. So I say all that in those categories. We have many pieces of legislation in Washington. We have in bills that are very, very important. And I can think of a few. I know that there's so many more things we need to talk about, and I really want to hear from our legislators. I know all of you do as well. But I just wanted to highlight a couple of things that I think are very important, and particularly Age Guide and many other organizations are looking at the Illinois Family Caregiver Act and actual support funding for that. There is equity issues with our community care program, and there's legislation to have a more equitable system with the home support program as well as community care program. There is the Illinois Family Caregiver Income Tax. We're looking at many things to support pieces of our infrastructure, our actual backbone to have services not only for our older adults, but for those caregivers. So I close with this. We have a real opportunity. We're all together today, which I love. And our opportunity is that we have all wonderful voices. We all have wonderful voices. We all have things that we believe in and we're passionate about, that we're working on. And I might not have every single, and that's for many reasons, limited time mostly. But there's so many issues that we're working on, and we have this wonderful opportunity to raise the voices of older adults together. I so look forward to doing that with all of you. And we need to contact and have connection with our elected officials, with those that are running when they're up for re-election, or they're running for the first time, or whatever that situation is. We have this wonderful opportunity to work with these amazing people are leading our country, leading our state, and share our collective voices, share our stories, and share the stories of those that are most vulnerable, who don't don't, not that they don't feel that they have a voice, but they just can't use it because they have other priorities. They have to get well. So we have to them. We're advocating for them. That's why we're all here today. So I look forward to raising our voices together and taking action and live systemic change so our older adults in our state and our country live the most dignified, wonderful life they have, and we can do that together. So thank you very much for having me. Appreciate it and happy to take any questions, and I will happily put things into the chat as well and look forward to working with all of you. Thank you.
Thank you so much, Courtney. It's so great to partner with you. We're all on the same page, carrying the same messages, such important work that we can do here together. And that leads so nicely into our next speakers who will be sharing kind of from the grassroots efforts that folks are doing on the ground, working with older adults. I want to introduce our next speaker, Sherry Pearson-White, who's director of the Patricia A. Jones Center at Waukegan Township. She is one of our very dedicated and successful funded partners doing some creative and innovative services in the community. And Sherry is going to describe for you what essential services means to older adults in the community. Sherry, I'm going to turn it over to you.
Okay, thank you. As she said, I'm Sherry Pearson-White. I am the director of the Patricia A. Jones Center for Waukegan Township. Waukegan Township is a form of government, local government, and I've been at this location for over 20 years. The Senior Center provides services for those 55 and above, or as we like to say, 55 or better, in Waukegan, North Chicago, Park City, and Beach Park. We've been a trusted and respected source of assistance to our community for over 30 years. We've been providing transportation, we've been providing exercise and wellness programming, recreation, technology, advocacy programs, all here at our center. We also serve a very diverse community. And I want to share some of the demographics of our community so that you have a better understanding of our challenges. We do utilize census data to determine the greatest need in our communities. So data shows us that Waukegan Township has a population of about 89,000 individuals. 35% of those residents are 65 and above. And the largest ethnic group in our community are Hispanic, with 63% of the residents being Hispanic. Township has a higher number of foreign born residents, so English is not the primary language spoken in households, 54%. Because of this data, half of my staff is bilingual. The poverty rate in Waukegan Township, 14.3%, in comparison to Lake County as a whole, which is just 7%. We are situated like right next door to some very affluent neighborhoods, Lake Forest, Lake Bluff, Glencoe, Highland Park. So that changes the dynamics. We still have our challenges, but we're doing it right next door to some very affluent neighborhoods. During our last annual report, we reported about 11,000 units of service. And you have to also understand that was at the end of the pandemic. Well, it's not over yet, but that was towards the end of the pandemic. We do annual reports every year. So right now we're clocking in at about 25,000 units of service. So we're coming back. We're not fully back, but we're coming back. And there are a total of 15 senior housing complexes inside Waukegan Township. Of the 4 cities that we serve, only one has a grocery store. Only one has grocery stores inside of the community. So that presents a challenge. So what we do is we offer transportation to and from grocery stores for our seniors. We also offer medical transportation to go to and from doctors. So they can go grocery shopping, they can go to Walmart, they can go see their doctors Monday through Friday, 9 to 4. But what we also found out is that we were falling short in trying to assist these individuals with things that they needed to do on the weekends. Because we have we partner with Pace Van Pool Services to provide mini coach buses for us. So we're able to do the medical, we're able to do the grocery shopping, But as I said, we were falling short. So we reached out to Age Guide to try to assist us with what we could do to assist seniors with their transportation needs on the weekends. And they afforded us a grant, which was very nice. We appreciate it. And we are now able to offer transportation to seniors on the weekends. We do this through Uber and through Lyft. So what a senior, the only qualifications that a senior needs to have to use our transportation service on the weekend is they have to be 60 plus, and they have to have a cell phone. What we do is we will schedule all the transportation during the week. As soon as we register them for the transportation, they immediately get information from Uber or Lyft, confirming their transportation needs. After that's done, we're off on Saturdays and Sundays, but this transportation is still being provided, still going on, even though we're out of the office. And we come back on Mondays and we contact all of the individuals that we have sent transportation for during the weekends, just to verify everything has gone well. To date, we have had no problems. Everything, the seniors love the new service that we provided. We were a little scared about the Uber and Lyft transportation, because we knew that, you know, when you try to change things for seniors, it might get them a little anxious, and we didn't want them to be anxious. But from what we've heard, they truly enjoy having those services available to them. And we're grateful to Age Guide for allowing us that opportunity. We also have exercise programs. Now, we've had evidence-based programming here at our center, but we've never been the individuals who actually instituted the evidence-based exercise programming. But we now have that through Age Guide. And the program that we were afforded was the Matter of Balance exercise program. That program has taken off tremendously. We are now able to offer Matter of Balance outside of our facility, and that has never happened before. So we're grateful to Age Guide for that. We also have technology programs that were afforded us through Age Guide. We utilize the services of Age Guide in our technology programs. When Age Guide had the Tablets to Seniors program, we had about 10 recipients receive tablets. And technology is a struggle in my community. Individuals don't have computers, they don't have tablets, they don't have any of the resources that they need for technology. So we do offer technology programs, but each of the individuals who received the tablets from Age Guide, the tablets were hand delivered. They had a brief in-person tutoring session on how to connect to Zoom. During one of the online sessions with an organization called Tech Pals, seniors were taught how to use the tablets to connect to the internet, speak with family, doctors. They were able to connect to Facebook, Google Meets, Skype, and of course, they were able to connect to us in our programming. They were also taught how to connect the programs within the community. So if they wanted to connect to maybe a library or connect to a church, they were able to do that with the utilization of these tablets. One of our seniors actually even tried to put on their own little Bible study through Zoom. So she was a little successful, but she was very excited about having the tablet and having that opportunity. Some of the programs we offer, we could not do without Age Guide. So we're so grateful for the opportunity that they have afforded Waukegan Township Patricia A. Jones Center and the seniors of my community. So again, thank you.
Thank you so much, Sherry. Really appreciate you sharing all of those resources and how well we've been working in the community throughout COVID and beyond, as we've seen so many new needs and have needed to adjust to those things. So appreciate you sharing that. And now I would like to introduce Amanda Foltz, Coordinator of Caregiver Services at Catholic Charities Diocese of Joliet. Amanda is an expert in the field as she has worked in aging at Catholic Charities in a variety of roles, from direct services to management, and she's a resident of Kankakee in our region. Welcome, Amanda.
Thank you, Gretchen. Thank you for having me here today. I'm going to talk a little bit about the importance of family caregivers, and then a little bit about an assessment tool that we've been using to help family caregivers. So I've been working with family caregivers on some level over the span of my 16-year career as a social worker, and I've learned a lot of things. One of them being that one size does not fit all when it comes to caregivers and addressing the needs of caregivers. It's really important for us to recognize the diverse experiences and individual needs that each caregiver has. Caregivers often have multiple roles. In addition to being a spouse or child, sibling or loved one, family caregivers wear many other hats. They're a chef, they're a personal assistant, they're a stylist, a chauffeur, they're an advocate, a companion, and a nurse, to name just a few. Caregivers regularly make sacrifices for the well-being of their loved ones, putting the needs of their loved ones ahead of their own needs. Oftentimes, caregiving is 24 hours a day, 7 days a week, and many caregivers can experience long-term chronic stress, which can affect the caregiver physically and emotionally, and without intervention can lead to caregiver burnout. The needs of family caregivers are often overlooked and go unnoticed, as the focus and care is usually placed on the needs and the medical condition of the loved one they are caring for. Family caregivers are responsible for providing care, support, and physical assistance to their loved ones, but who is supporting the caregiver? We are. With the guidance and funding of Age Guide, we're able to stand alongside and support these family caregivers in the crucial roles that they play. Caregivers often shed tears and breathe a sigh of relief upon learning about the resources and supports we're able to offer them. So I'd like to talk a little bit about the TCare tool, TCare assessment tool for caregivers that we've been using for a few years now. So TCare stands for Tailored Caregiver Assessment and Referral. TCare is the first tool of its kind where it assesses the needs of the caregiver rather than focusing on the care receiver. Through a series of questions, the TCare assessment identifies the specific drivers of the caregiver's distress. With the specific stressors identified, an individualized care plan is created to help the caregiver feel more equipped to manage their role and identity as a caregiver. We first meet with the caregiver and complete an initial assessment, and then we meet again to discuss the TCare findings. We work together with the caregiver to create a care plan based on the TCare findings. The TCare process is then repeated at 3-month intervals to check in with the caregiver regularly, and we can adjust the care plan as appropriate. TCare helps me better understand and help the caregiver by identifying and addressing some of the unspoken needs of the caregiver. For example, a caregiver may come to me and express the need for help in the home with their loved one. And while we can provide services and resources to help meet this need, the caregiver may also benefit from attending a support group of their peers to vent feelings and emotions. The caregiver may benefit from some education on Alzheimer's disease or estate planning. The caregiver may desperately need a break and may benefit from respite funds. So with TCare, care managers, agencies, and health providers can focus on what matters most, taking care of the caregivers and their loved ones. Caregiving can last years, and I like to remind the caregivers I work with that the caregiving journey is a marathon and it's not a sprint. Standing beside the caregiver, letting them know they are not alone, and working with them to create a plan to reduce their stress to sustain their role is vital. So now I'd like to introduce to you a caregiver that we've been working with, and he has experienced TCare firsthand, Mr. Glenn Davidson. Glenn and his wife, Kelly, care for his 90-year-old mother in their home. Thank you for taking the time to be here with us today, Glenn. I'll pass the mic over to you.
Can you hear me?
We can hear
Yes.
you.
Okay. Trying to fix it so maybe you can see me, but anyway, thank you for having me this morning. My name is Glenn Davidson, and I also live in the Kankakee Bourbonnais area. It's been quite challenging. I never thought that I would be in this situation, but actually my mom and I talked about it years ago that if she ever found herself in a situation where she would have to have care, that she wanted myself and actually my wife to be the persons to take care of her. So 3 years ago, she called me. She was living in the state of Florida and said that she was ready. She recognized that she was having some deficiencies. So she called and said she was ready to come live with us. So we went and picked her up from Florida and brought her back to the Kankakee Bourbonnais area. And over the last 3 years, we've noticed, well, we actually saw the gradual decline. And it's been quite significant, to say the least. So fortunately for us, we were connected with Catholic Charities, initially with Caitlin, and then with Amanda, who's been fabulous. She's just provided us with all kinds of information in regards to how to go about dealing with different situations with my mother. And actually the respite program, I would be safe to say that the couple times that we've actually used it, perhaps have done a great deal with preserving my marriage, because it's not just myself who has to take care of my mom, it's my wife as well. She does a lot of the physical things with her in regards to bathing, dressing her. She provides most of the meals, or all the meals. I can buy things pretty good, but I'm not a very good cook, which helps tremendously. One of the challenges is, Monday through Friday, she's kind of she's her caregiver, but on the weekends, really there's no real, that I know of at this point, services to help out on the weekends, but we do the best we can. Amanda talked about the T-Care assessment, which I've taken a couple different times. And one of the interesting things I found out about it was, in talking about some of the different things, the emotions that came out of it, things that I didn't recognize or I didn't really know I was going through, and feelings that I was feeling were brought out through some of the questions that came out of it. And even though it was emotional for me, and it continues to be, I think it was very helpful. And I talked to a lot of my friends that I'm 63. And so I have several friends that have or are taking care of parents or brothers or sisters. And we talk about our experiences, and a lot of the experiences are the same. But the resources that we've received from Catholic Charities, especially the respite program, as I stated earlier, has been very beneficial to us, which has given us the opportunity to get away, for a little while and kind of reconnect with each other, but also gives my mom an opportunity, to get away from us as well, because those are challenges too that I'm sure she's facing. And she's dealing with some Alzheimer's and dementia all at the same time. And as challenging as it is for us, is as challenging as it is for her, because she'll say to us from time to time that I'm doing the best that I can. And if I could do better, I would do better. And that hurts, because I know that if she could do better, she would do better. But at the same time, it's tough. It's just a tough situation to be in. But like I stated earlier, I really appreciate what Amanda has done. We've actually had an opportunity to take advantage of some of the counseling that she and Caitlin, who also works for Catholic Charities, has provided to us. And it's been quite beneficial, you know, an opportunity to talk about those feelings and those emotions that we're experiencing. So once again, I want to say thank you to Amanda and thank you to Catholic Charities for providing these services to us.
Thank you so much, Glenn. We really appreciate you sharing your honesty about the emotional journey of caregiving. It's so important for us to be able to hear from folks who are going through these things. Thank you, Amanda, as well. It's one thing to hear about what a program does, but it's so impactful to hear how a program actually impacts people's lives. And you really painted a picture for us, Amanda and Glenn, about why these services are so important. And to that end, I'd like to welcome Marla back to the stage to share our policy opportunities that we are advocating for this year. And I will put those back up on the screen.
Thank you, Gretchen. So remember that little secret to longevity that I shared with you a little bit earlier? We said the key is social connections, community resources, and strong support systems. And I think you really heard that through our speakers here today. Our polls showed that most of you not only plan to live a long time, but you also plan to stay in your home and in your community. So guess what? If that's going to be, if we're going to live to 80, 90, or even 110, our policies will need to change now to ensure that everyone gets access to the support we need to age well. But how do we create a society where we all have access to health and vibrancy in our later years? We already know what works. Now we just need to invest in it. So aren't we ready to do that? Well, you think we are, but not quite. As our aging population continues to grow, funding just isn't keeping pace, which is only exacerbating the existing inequities to service access. As aging Illinoisans become more racially and ethnically diverse, Age Guide holds fast to its commitment to viewing all aspects of service delivery through the lens of equity. This year's advocacy priorities will focus on building healthy, age-inclusive communities and support systems for all Illinois older adults and their caregivers. Equity is longevity, plain and simple. At the federal level, we are asking that there is a clear need to increase the investment in Older Americans Act funding. And here in Illinois, there are some policy and legislative opportunities we cannot miss. First, we have an opportunity to strengthen those essential services that you heard about here today. We're asking for continued support for home and community-based services that are essential to helping people stay in their home and community. To better support Illinois' growing population of historically marginalized older adults, here are our priorities for fiscal year 23. At the state level, we're asking for support for the governor's fiscal year 24 budget for home delivered meals, for social isolation programs, and Alzheimer's disease and related disorders. Demand for these programs continues to increase. And the second bullets here have both been recognized as statewide initiatives and priorities by the Department on Aging State Plan. These programs include the services you just heard about from our speakers. Social connection services like technology, health promotion, online learning. Social isolation was recently recognized as a health crisis, and that's why reducing social isolation was a statewide initiative, even before the pandemic began. Our other statewide initiative is to collaborate with the aging partners to address the needs of people with Alzheimer's disease and other related dementias, and the specialized needs of their caregivers. As you heard some of that from Courtney here today. At the federal level, appropriators must recognize that the foundational capacity of the Older Americans Act programs needs to be dramatically increased to both meet the ongoing needs that exist, even as the pandemic begins to wane, and to address the rapidly aging population. Our second policy priority is to strengthen family caregiver support. Last session, the Illinois General Assembly granted our request to allocate for the first time $4 million in state funding to support Illinois family caregivers. We are truly grateful for this funding. You just heard Glenn and know how impactful these services are on the families here in Illinois, as well as the caregivers. This assistance provides a great return on investment, saving the state costly Medicaid payments by delaying those nursing home placements and keeping older adults and family members where they want to be, at home. Age Guide asks our state legislator for an increase in that commitment to support caregivers for a total of $6 million in 2024. This will allow us to serve more caregivers like Glenn and provide essential services and supports and resources. At the federal level, we are asking to increase that investment in Older American Act Title III National Family Caregiver Act Support Program. If we are going to enjoy a healthy, happier, longer life, we need to embrace supports we already have in place through the Older Americans Act. You can join us in this effort. Take the first step today and talk to your elected officials about these priorities. Some of them are here with us today, and they are going to be sharing how they're addressing equity and longevity. But there is one thing you can do. In the chat, you're going to see a link to our website. If you want to click on that link, you'll see Age Guide's action alert. From there, you can send a message to your specific elected officials with just a click of a button. By entering your address, let them know that you want to support these aging priorities. And now I'd like to turn it back over to Gretchen so she can introduce our elected officials and you can hear from them personally. Thank you.
Thank you, Marla, and thank you to all of our speakers today. It's been great hearing from everybody. And now we're going to hear from some of our state and federal legislators and some staffers as well, and hear about how they're addressing essential services, family caregivers, and other supports for older adults. Now, remember, if you have questions for the legislators, please put them in the chat. Hopefully we'll have some time at the end. We'll be able to come back around and read them off as time allows. But I'm going to stop sharing my screen so that we can see who's all here. I would like to thank Dan Sikowski so much for being here with us today. We'd like you to go ahead and go first in sharing with us your priorities for older adults this year. Thank you for being here. Congresswoman, I think you're on mute.
There we go. Hi, everyone. I'm so happy to be with you. Congresswoman Jan Schakowsky. I represent the 9th Congressional District. Thank you, Gretchen, for the introduction. Thank you, Marla, for your incredible leadership and for the work that is being done by Age Guide and all the legislators who are here. But especially I want to really thank let's see, it's Sherry and Amanda and Glenn and the people who are actually working in the field and the caregivers who are making things happen. And I just appreciate you so very, very much. So I have been involved in aging issues well before I myself was a senior citizen. Before I even went to the state legislature, I was part of a home care coalition, a home care coalition, and then in the in the state legislature advocating for older Americans, but also very much so now it's my priority in the Congress of the United States. I'm a part of a tremendous Care Can't Wait coalition that is made up of not only aging advocates, but home care workers, union members. You know, we talk a lot about home care, family caregivers, but there's also, you know, we want to be able to have people who are hired to help us. And the average wage right now for home care workers is $12 an hour. You can't live on that. And so we want to see that that people who work in the field, as well as the family caregivers, and of course to the bottom line, to help the aging people themselves be where they want to be at home. Certainly I voted for that in the early voting here. And I think I think it was 98% of you said that you want to be at home, and we can provide it. People, you know, I understand that sometimes you have to go to a nursing home. And by the way, I'm also very much involved in legislation that would improve care at nursing homes, and legislation that would require nursing homes to divulge who actually owns these nursing homes so that we can have more control. But let's talk more about caregiving. It was our hope at the beginning of last session of Congress that we could get as much as $100 billion to go into caregiving, home and community-based caregiving. That didn't happen, but I did want to tell you some of the good news. But first, let me just say, as a member of Congress, I want you to know that in my office, we spend a whole lot of time solving problems for caregivers, for older Americans, to just figure out how we can access the best care that we have. And we were able in the last session of Congress to get over $1 million returned to the people who needed help, either the family members or the senior citizens themselves. So you need to also rely on not only my office, which now represents part of McHenry and Lake counties. I used to only be in Cook County, to call on your legislators, your members of Congress, to help access some of these benefits. And I say that also to Age Guide, to make sure that you're doing that as well, to make sure that we can help you. But let me talk to you about some of the good news of the last session of Congress on legislation that we actually passed. There is a major piece of legislation called the Inflation Reduction Act that had a number of things that are really, really helpful. First of all, it begins the process for Medicare to be able to negotiate with the pharmaceutical companies to start lowering the price of pharmaceuticals. We pay as Americans more for pharmaceuticals than any other peoples in the world in other countries, even when it's the exact same medication. I like to think that in a way we're like chumps when it comes to big pharma, and we have to rein in those costs. And that's going to happen unfortunately not for a couple of years. The negotiation is going to be very important. First year, it's going to be 10 drugs, then it's going to be 15, and the numbers will continue to go up where we lower the cost. We have a cap now on insulin, as you know, I hope, because it went into effect on January 1st. And for Medicare beneficiaries, insulin will not be more than $30 for $35 for a month's worth of insulin. The President Biden has said he wants to extend that to all Americans, but right now it's just people on Medicare, $35 a month. We also have a cap on Part D co-payments of $2,000 a year. Now that sounds still like a lot of money, but some of you are paying a lot more than that. And that is going to start in 2025. We have we have also we are helping protect the let's see, let me get that. I was very involved in making sure that we were in another legislation in no, that hold on, I want to get that for you. The HELP program. We have the HELP program that will help with drug costs for lower income people. That's also part of the Inflation Reduction Act. And we will now make drug companies pay a penalty. They'll have to pay back if they raise the price of their pharmaceuticals before the rate, more than the rate of inflation. They are going to have to return that money to the government. So we want to have a disincentive for these pharmaceutical companies to raise the rate beyond the rate of inflation. So let me tell you some of the other bills that we got done that have to do with money that we're going to be spending. We raised in the last session of the Congress the budgets for things including senior nutrition, the home and community-based program, but not enough. Only $410 million, which, believe me, when you talk about millions from the federal government, that's not a lot of money. We usually are in the billions and billions, so that's really not enough. We raised the amount of money for caregiver respite programs, which are very, very important. And we raised the budget for senior $408 million for senior community services. We also raised the money for the SHIP program, which helps people to navigate the traditional Medicare. I was able to get past a bill that is the Lymphedema Treatment Act. Those of you who have experienced breast cancer may know very often it results in a swelling. And yet Medicare has not covered in the past the compression garments that are needed. And it should be part of Medicare, and now it is, thanks to the legislation that I and a lot of other members were able to get passed. We managed to make sure that there were going to be no cuts to Social Security and Medicare, but that's not enough. We want to make sure, particularly, that we not only protect these programs, that we enhance these programs. And so I have introduced legislation. It's in the House and in the Senate right now, that would raise how much Medicare, how much Social Security benefits, and it would be an increase of $200 a month in Medicare, in Social Security benefits. We cannot let anyone decide that it is time for us to cut Medicare and Social Security. We have to enhance them. So this is my Social Security Enhancement Act that would increase the price that is paid, that the benefits that are paid. And I want to remind you something about, if anybody ever talks to you about, oh, Medicare and it gets too much money, you have paid in every paycheck into Social Security. That is not an entitlement. It is an earned benefit. And anyone who wants to cut Social Security is suggesting to steal the money that over your lifetime you have put into Social Security. And we are no way going to let that end. We also are making sure in the Social Security Enhancement Act that Social Security is solvent for the next 70 years. And we're not going to do it by raising the cost to pay that you pay into Social Security. We're going to ask the wealthiest Americans to pay more into Social Security. I wanted to mention one other thing that I've been involved in, and that is Medicare Advantage programs. And I just want to say, some of you who have Medicare Advantage programs and are getting the benefits that you want and at the price that you want, that's fine. But we have found that people, particular people who end up being sick, who are traveling, who leave the state and their coverage is not there, that Medicare Advantage is not Medicare. It is private insurance. And what we have found, and what research has found, is that Medicare Advantage is getting more per patient than traditional Medicare from the government. And if we took some of those overpayments that are going to Medicare Advantage and put them into traditional Medicare, we could cover eye care, hearing care, dental care. There would be enough money in traditional Medicare. So one of the bills I have would say that you can advertise for what they now call Medicare Advantage, but you can't use the good name of Medicare. You have to call it something else because it is not Medicare. It is private insurance. I just wanted to tell you a couple of the other bills that I have introduced. A number of them do have to do with nursing home care. And we know that during the pandemic, the COVID pandemic, that the largest single group of people who died were people who were in nursing homes. And we have to make sure that the care is up to par. And I am sponsoring a bill right now that would increase the staffing at nursing homes. As I said, make sure we know who is owning the nursing homes and making money from that. And so there's a lot of work I think that needs to be done because there are situations where people need to go into care in nursing homes, and we want to make sure that the quality of care is there. I am the founder and co-chair of the Democratic Task Force on Aging and Families. And that includes a lot of members of Congress who make it a priority in the House of Representatives. And sometimes we have support also from the Senate, but to really focus on what are the bills that need to be passed? What are the appropriation levels that are adequate to meet the needs? How do we make sure that our precious programs like Social Security, Medicare, and Medicaid are protected and available to all people? And as was pointed out, it has to do not only with the aging of our population, but more and more, I think we've seen the privatization and some of the companies that get involved in healthcare are taking more money than they ought to. So, let's work together. I'm so happy to work with AARP, and I really appreciate the presentation that we had, and all of your organizations in the community as well as throughout the region. So just remember, I have a number of cities and townships in McHenry and Lake counties, as well as in the city of Chicago. And I want you to consider me your partner. I'm not going to be able to stay on the whole time. I know that Mary Beth Stein, my amazing staff at my office at the Jan Schakowsky for Congress office, has been doing a great job. She is here and can answer particular questions that you may have. She deals every single day with the phone calls that come from older Americans and does an amazing job of helping them. And with that, as we say in the Congress, I yield back my time.
Thank you so much, Congresswoman Schakowsky. I'm just applauding over here. I think everyone else is as well. Thank you for being here, and thank you for being such a great advocate. At Age Guide, we were so excited when we heard that the redistricting lines had redistricted you right into the Age Guide region. As we know, you're going to be a great advocate for all of our older adults in this region. If you have just a couple minutes, I'll ask if anybody has questions.
Sure.
If anyone would like to unmute themselves and ask the Congresswoman a question, is that all right, Congresswoman? Any questions that anyone has? I'm not seeing anything in the chat right now. You did give us a nice list of legislation that we can keep track of and follow.
We're happy to send you the list of information that's on the docket, because we could use your help. One of the things about advocacy, and all of you can be great advocates, is to get your members of Congress, and that goes also for the state legislature, to co-sponsor these bills, to give them a buzz and say, I really could use your help as a caregiver at home, and here's some legislation that could help. Would you co-sponsor it? Here's the number. Here's the bill name, and we really could use the help.
And we can get that list out to everybody who's on the call if you'd like to send that over to me. That would be wonderful. Thank you, Mary Beth. I know you'll send that right over. Thank you.
Yeah. Okay. We're more than happy to do that. And I wanted to thank all the people who spoke, because if Glenn, who spoke about his family and the needs of people at home, and we recognize the challenge that there is, and we need to provide you with more hours, with more support, and I think that is a responsibility right now of government to do our best to help. So I want to be there for you and all the people like you.
Great, thank you so much. We did have a question in the chat from Amy Brennan asking if it's possible to increase funds for the Older American Act in Congress and tie the rates to inflation. And I know this is something that you do support, Congresswoman.
Every session of Congress, I have supported raising the amount of money for the Older Americans Act and its various programs, and I'm not gonna stop now. I think it's one of the most important package of supports that we could possibly give, and I'm gonna definitely be there, and our task force will be there as well to really fight to raise the funding for the Older Americans Act. Yes.
Wonderful, great champion for us. Thank you. There was another question about whether your office provides resources or to direct people to resources in the community. And I know Age Guide has spoken with your staff, Mary Beth Stein, who's on the call, and we collaborate on making sure that all of those resources are available and that people know where to go to get those. Most likely, if somebody is in our Age Guide region and they call your office, you're going to direct them toward us, and we'll direct towards one of our funded partners in the community. We have funded partners in every county who provide those aging services. But was there anything else you'd like to say about those constituent services, Congresswoman?
Absolutely. Sometimes we may direct them to you, but we know too how complicated some of the rules and regulations are, and we can cut through that red tape. And so I don't want people to hesitate. The other thing that we do in our office, for example, with Medicare Part D, the prescription drug program, Mary Beth will help you navigate that, because sometimes the drugs that you took last year are no longer being you won't get it at the same price this year. It's not on the list anymore, and so she'll go through it in groups or individually to make sure. That's one of the ways she has saved people money. I remember one woman would have paid $5,000 more in a year if she had stuck with the same list of drugs that she had used the year before. So you want to check every year on your Medicare Part D prescription drug plan. And that's the kind of thing that we can help guide you through.
Thank you so much, Congresswoman. Really appreciate it. And thanks for staying a little extra to answer those questions.
Okay, and thanks to the legislators from Illinois, because I know Illinois has been very responsive to your agenda, our agenda, and making things happen. And together with the federal level, the state level, and all of the great work that all of you do, we can make life better for all older Americans. Thank you.
Congresswoman, can I just ask you a really quick question?
Sure.
I'm Sharon Langloss Johnson. I am State Representative Tom Weber's legislative aide. One of the things, I heard you say you're trying to get an increase of $200 for Social Security. I can tell you my mother would definitely benefit from that herself. She actually had to move out of her house because she couldn't afford the property taxes anymore. So, but with that, what happens a lot of times is that would kick a lot of people off of assistance roles. So like my mom is just over that, $50 over that barrier of that, poverty level that they use for Medicaid or for LIHEAP or for all those different services. This happens even with people using Medicaid and they're getting the child care benefit. If they make that 25 cents more, then they are thrown off and they can no longer work because they can't afford the daycare. I'm wondering if there could be a federal law that allows Medicaid to go up on a graduated basis, so we don't just wipe people out. If they make an extra quarter, then you only lower it a little bit, and it would allow people to stay on some assistance and work their way off.
That's a really, really important point that you raised. And I think what we should build into that is that the amount of money that people can have as assets or income does not then drop them off of the other benefit programs. I think that's a really good cautionary issue. And
yeah, it's
absolutely,
it's very difficult for our seniors and our folks who are single moms. They can't work, and that they want to work but they can't work because they can't afford daycare.
well, the amount, the level of assets allowed is also just ridiculously low, and does prevent people. That's a whole other issue of just, as you're pointing out, raising the level of benefit, allowing people to not have to then get kicked off of the meager amount that they get. Thank you for raising that.
Thank you. That was a great question. Thanks again, Congresswoman Chakowski, for staying and answering some of these questions. We look forward to continuing to work with you. And I know that there were some staffers who had brought some comments from legislators who wanted to present. And Sharon Langlois-Johnson, you were on my list. Would you like to go ahead and share from Representative Weber's remarks?
Yeah, sure. I just want to go a couple of bills that he has. One that actually is near and dear to my heart is the personal needs. You know, when I worked in nursing homes for 5 years when I was younger, we're talking in the 80s, it was $25 for personal needs that a senior would get being in a nursing home. That's all they get, $25. Since you know, 40 years ago, or 30 years ago, I think, since that time, it's only gone up $5 in the state of Illinois, and that's mandated federally. Illinois is one of the 4 bottom numbers on that personal needs allowance. So we are trying to get it pushed up to $60. There are other people, other legislators with bills trying to move it up. That $60 would also go to people who are in their home in care. So it wouldn't just be nursing home residents, it would be residents that were getting their care at home 24 hours. The other thing was seniors with getting a lot of times seniors want to work. You know, my mom worked till she was 79 years old. My dad was 77. Okay, that's unusual these days, but not so much anymore, and it's becoming more and more a norm. He has a bill to give credit to any employer, a tax credit, any employer that would hire a senior 65 and older. I know at 50, it's even hard to find a job because people, you know, they, oh, you're old. There was one more, giving seniors a higher income to be able to get pay less on their property taxes. Right now, our seniors, especially Lake County, they cannot afford their property taxes anymore. You know, and I use my mom's for an example. She had to move into a house my sister bought because she couldn't afford it. And that's really sad. You know, she worked till she was 79. So I just, and my only comment to you guys is, if we could get a better idea of how to get people these services, because it's really a struggle for people in our area. You know, we're not in those equity-based zip codes, but we have a very, very non-affluent, you know, middle class, working, you know, blue collar population. You know, we're mostly Caucasian, obviously, but you know, one of our towns has a 22% population on Social Security disability. That's bad. That is one of the worst in the state. That's one little town, but you know, we just don't have a lot of affluence. So our people are struggling, our seniors are struggling, our disabled are struggling. And, you know, and sometimes they're both. There's no housing. Housing is 5-year wait. So, you know, I don't know how else to, you know, try to help them. I mean, I'd love to be able to send them to your group, but some, you know, a lot of the programs, we're not in that zip code. So our people are left behind, quite frankly. And it's not fair. That's not equity to me. You know, our people are not getting equal because it should be based on low income and that's it. You know, it shouldn't matter, you know, what zip code they live in. You know, it should be, are they low income? And then they should be eligible for whatever the programs are. But that's not the way it is right now.
So Sharon, just so you know, Older American Act services, no income or asset guidelines for any of those services, and they're open to anybody.
No, I'm
Regardless of where
aware
they
of
live.
that. I'm just some of the other programs that are available. They're just, everything is zip code right now in the state of Illinois. And there's a lot of programs that are not available to our seniors and our residents. And it's really getting frustrating.
Thank you for sharing, Sharon, and thank you to Representative Weber for advocating for older adults. And are there any other staffers or legislators that we've missed on the call who would like to speak? We have a few minutes left here. Feel free to unmute yourselves and share with us if you brought a message from a legislator and you wanted to share for a few minutes about what you're working on at your office. Any other legislators or staffers? Right. I do see, thank you, Director Basta, for putting the IDOA contact information in the chat. If anyone is looking for resources, feel free to reach out to them. Of course, reach out to Age Guide.
So there was a question in the chat, Gretchen, about they wanted to know what programs are not available by zip code. They just wanted an example of what one of those might be. I don't know if Sharon can answer that.
Yeah, can you share what you were looking for that was not available? Not sure if Sharon is still with us or not.
We'll try and find that out from
Yeah, and
Sharon
I think
later.
reaching out to Age Guide, if there's something that you're looking for, that you're struggling, we can help connect you to resources. Older Americans Act funding.
I just put in the text, the Illinois Department of Revenue reminds eligible taxpayers to take advantage of the Senior Citizens Tax Deferral Program. So people can look and see that that's a state program.
Excellent. Great. Well, we appreciate all of you joining us today.
Yeah.
I want to remind you that we have a lot of tools and resources to help you keep up with the latest on what we're doing at Age Guide, what's important to older adults and their caregivers. We have a monthly newsletter that you can subscribe to called the Aging Report that is stuffed with useful information. So sign up for that by going to our website under News and Events, and those will be sent to your inbox. I also encourage all of you, if you haven't already, to engage with us on social media. As we end the webinar, if you're not already, go on and follow Age Guide on Facebook and on Twitter. And there you'll find that we post lots of useful resources, articles, information that can be useful to you, similar to the information that was shared here today. We also have a popular podcast which features themes from our advocacy priorities that you heard about today. So check that out on Age Guide or wherever you like to listen to podcasts. These things are a great way for all of us to collaborate and advocate for older adults and stay in touch. Following the call, I know a couple of you have asked if we'll be sharing the PowerPoint. We will send a follow-up email with our legislative priorities and links to our website and the slides from today. So thank you all for giving us an hour and a half of your longevity. We appreciate this time that you've spent with us. And this concludes our advocacy collaborative. We hope you found the information helpful, and we hope that we can be with you in person next year. You should have received a packet from us of materials, and following we'll be sending you another packet with all the follow-up information. So stay in touch and have a great day. Thank you so much, everyone.